Hello, I'm Will. Welcome to ResearchPod. It feels like hardly a day goes by without one crisis or another these days, be it one recorded in your social media feed, rolling out on your local news, or, in the worst case scenario, happening to you right now. Surviving, enduring, and recovering from the physical and emotional toll of these is hard, but also essential. The alternative is, well. Dr. Sara Spowart from the University of South Florida is a researcher specialising in the psychology of support around disasters. Our conversation today touches on war, natural disasters, poverty, assault, and the pandemic, so listener discretion is advised. Ultimately, though, her framework of integrative happiness sets out a vital tool for all those affected by trauma to find happiness and stability in their lives again. Dr. Spowart, hello.
Hello, nice to be here.
Thanks very much for your time. For my own sake, and for everyone listening at home, could you tell us a bit about your research, kind of where it started and how it's led to the interdisciplinary topics that you examine in your current book chapters today?
Yeah, absolutely. So my research has been a mix of different things. For whatever reason, I'd say most of my life, people seem to tell me things that they don't tell a lot of other people. Similarly, that's where this all kind of started in Tanzania, and then it just progressed from there. And I've seen this theme for sure of violence, trauma, mental health, and its interconnection with public health and poverty, and that if you just address one factor, it's not going to be successful, and you're not really addressing the bigger picture of what's going on. I didn't really start off with thinking I would focus so much on sexual violence and particularly the effects of sexual violence on a global level. It started when I did work in Tanzania, and I'll never forget, I was going to different parts of Tanzania for different organizations. I think it was 2009. There was this one project where there was basically a village of women that had all experienced rape. A lot of them had HIV from it and multiple times of rape, group rape, just these horrific stories. And they all kind of like lived in this village together. And kind of close by, there was this program that had been developed to try to help the most impoverished get help, get resources, get back up on their feet. There were some other people that survived by going through landfills and street kids. And I remember specifically when it came time to do the interviews for these projects about the women that lived at this village, there was just a line. I can't remember how long the line was, honestly. It went out the door. It might have been like 20 women, but these women all wanted to talk to me. Not that I could fix what had happened to them, but they wanted to tell their story, which was very unusual because usually with sexual abuse, people tend to be more secretive. They don't want to talk about it. Other work I've done for people that were from the Congo that had been practically everyone that I had worked with had been sexually abused there. They didn't talk about it, but they all had really bad depression. But these women, they all wanted to share their story and be validated, and they all struggled with a lot of different issues. And I just remember thinking, like, this is unbelievable. This is just such a problem. From the work that I did in Tanzania, there's all these different projects that I just kept seeing the same theme of the depression, the mental illness, the trauma, the sexual violence. And the projects were not actually designed for that. The projects were designed for learning skills so you can make money for food, or a lot of it was around trying to help people get education. But there was a huge gap in terms of people's needs and what I saw was actually happening, which was so much more horrific than the programs were even aware of.
You deal with some profoundly hard topics with people in profoundly difficult situations who are having the worst experience possible in life on the planet. How do you maintain your well-being and your mental resilience to have that kind of reflected back at you?
Yeah. One person asked me this once, because I find that I learned a long time ago, I'm not sure when it was, probably after my Tanzania trip in 2009, I learned that people, I don't say can't handle, but it disturbs them to hear some of these things. I remember one of my Thanksgivings, somebody asked what I did and I started to talk about it. And this was when I worked with rape crisis and trafficking survivors. And about 10 minutes in, everyone got silent. I was like, okay, I'll just stop. Like, I can just tell everyone is uncomfortable and I don't want to affect everyone's moods. I would say looking at the humanity of everybody, and this might sound more spiritual in approach, but it's really what I saw with Tanzania, that it can become a society-wide issue, violence, mental illness, all these things. What is the difference between me and this other person? I don't know. Seeing the humanity, trying to see myself and others, trying to see that we're all people and that we all matter, we all have value, and approaching it from more of a hopeful standpoint that this is terrible, but I believe there's solutions and I would like to find some of those solutions. So coming at it from a position of, okay, this is terrible, but what data can I take away from this that can go towards a solution? And I think the first time I had that insight was, I want to say 2009. There was this one boy, I think he was 13 or 14. He had been abandoned by his family and he lived at a landfill. He went through the landfill to get stuff to survive. And I saw this as well a lot in India. I remember him being very upbeat and smiling. He'd also try to do performances in the street. And I remember just seeing the humanity in him and feeling a sense of love and compassion and that there has to be a solution. So seeing the humanity in all of us, I think, is what helps me to do that. And the belief that someone's different from me, separate from me, actually makes all of that harder on yourself. You might think, oh, it protects me. It makes it harder. Because if you feel someone's very different from you and separate, then hearing these things is like, oh my gosh, go away. But if you see, okay, this is a human being just like me, somehow it makes it easier.
You talk about this research coming from a place of crisis, of sexual violence was so widespread and so enduring that to a lot of people listening to this, that must seem an entire world away. But that is not the only place where these crises happens, where the impacts of sexual violence, of humanitarian disaster happen. So to bring things back maybe to a much closer experience, how do you see that life in the Western world, in Northern Europe, in North America, is reflecting some of those same experiences and responses to the various multitudinous ways in which life is very hard for a lot of people right now?
Yeah, absolutely. Well, I haven't worked in Europe, but I did live there for a time. I studied abroad in France, and I've spent some time in some of the other countries as well, between all the way from Russia to Spain. I didn't find it was something that was talked about. I did find that myself, the people that I knew, people that I did studying with programs, everyone experienced a lot of harassment. There was a lot of sexual harassment. It was more scary to be a woman, but it wasn't something that was addressed. And if anything, you were kind of blamed for it. Like, it's your fault. It's like, okay, I guess it's my fault for existing. I didn't really see that be overt, but I'm sure it's a problem. And the reason I say I'm sure is because it seems to be a problem. It's pretty widespread. In India, when I worked in India, for example, the trains, they had a special section for women because women would be sexually assaulted and harassed on the trains. I mean, it's such a problem, they had to actually separate. And imagine how stressful that must be just to try to function in the world. And in terms of poverty, in terms of public health, it hurts society. It actually hurts society. A lot of people think, well, what does it matter? It actually does matter. It causes a lot of problems, a lot of health problems, economic problems, mental health problems. People can't develop to their full potential. In terms of closer to home in the West, and this was actually part of the interest as well in this whole topic, I remember thinking, well, the US isn't like this. It's better there. So what happened was I started working in Florida. I went to University of South Florida. I started working in Florida in Pinellas County, which is a county of about 1 million people, but it also spread to Pasco County, Sarasota County, Hillsborough County, the work that I did. And I ended up working, not in the beginning, but I ended up working as a trauma therapist and a crisis advocate, and then a sexual assault specialist, which they used to call rape crisis specialist, rape crisis counselor, but the word rape upset people, so they changed it to sexual assault. So what I found was we were flooded, we were inundated. There was way too many more cases than we could handle. And you would think, well, it's just certain types of people this happens to. I mean, there was a lot of shocking stereotypes that came across. But actually, I mean, I had a lot of kids a lot of people in my caseload that were kids. We had a person that was a specialist just for kids. It was very prevalent. And the thing that helped me, and actually helped a lot of the people that were able to mentally handle staying, because a lot of people would leave, was instead of thinking, oh, this is not a problem in our society, this is a rare thing, so every time someone would come in, it would be upsetting, be like, no, this is a prevalent issue. It comes in different forms, but when people had different types of violence happen against them, taking aside the law and the fact that most people that do sexual assault, the vast majority don't have any consequences and people don't believe them, it ruins lives. These people, and it wasn't just women, it was also men. A lot of times they couldn't go to work, they couldn't function, they just fall apart. They couldn't live in the same city. We'd have to try to relocate them. It changed them. And sometimes people would be actually very high functioning, and then these things happen. And people think, well, that's never going to happen to me. A lot of these people, just normal people, maybe they went to some sort of event, like a family event with neighbors. I mean, it could happen to anybody. So it might sound negative, but this was part of the research. And then the other phenomenon was the human trafficking piece, that I started seeing more and more people coming in that, because with rape crisis, you don't have to have an ID, you don't have to have your real name. We just help no matter what. People coming in, 15, 14 runaways, totally traumatized, and then they get picked up by some guy, a group of guys. So I saw more people that seemed like they were being trafficked, and that sort of segued into my interest in the trafficking issue, and then some of my colleagues there as well. I ended up living in DC, I think a year and a half or 2 years. I specialized with trafficking victims. That was quite shocking as well, because it was mostly Americans. The vast majority of sex trafficking victims, a lot of people don't know this. They think, and it's not okay either way, but a lot of people have this stereotype of it's someone being shipped over from Thailand or Russia, which is still not okay. But actually, the vast majority of sex trafficking victims and even child victims are American citizens. A lot of kids from the foster system. With the work I did in DC, and it's a very international city, I only had a handful of people from other countries. There was one girl, I think, from West Africa, because I remember I had to speak French with her. And the other thing that was shocking, because I would go on different ride-alongs with law enforcement sometimes. I did some ride-alongs with, I remember, I think it was U.S. Marshals, I think it was FBI one time, and then the police. But one of the main spots for the trafficking, for people to pick them up, was 6 blocks from the White House, and it was on the way, and people think, oh, it's late at night. No, it was terrible. It would be like 5, 6 in the morning. Educated people that worked near the White House would stop there on their way to work, and they would buy a girl, and then they'd go to work. A lot of it was very counter to what I thought. I really was very shocked at how prevalent the issue is and how it's not really taken seriously. And even I remember doing one of the ride-alongs, I think it was with the U.S. Marshals, and they were just saying it's really tough to get these people prosecuted, and they have to have a lot of evidence against them. It's a growing issue. So in terms of closer to home, it takes a lot of different forms, but I think at the root of it, it's not seeing people as people, it's seeing people as objects, which is a general issue worldwide when you look at racism and minority groups, and it's looking at people as objects, not people.
You mentioned there the similarity in the attitude and expectation of value between racism, between other forms of abuse and prejudice. For people who fall within multiple categories of that, who are in that intersection of being, a black trans sex worker, there is a lot of ways in which life is going to be especially hard for them. And it seems like at some point, society, as you say, seems to just kind of expect or accept that, well, they have done the wrong things. I have done the right things. And that insulates me or protects me from this ever happening in my life. How far away is any one person from being that much more disadvantaged? I hear people talk about, the economic disadvantage of you're never 3 months away from being a millionaire, but you're always 3 months away from being homeless. For people who might not expect to ever be on the receiving end of state violence or sexual violence or any kind of, compounded abuse, do you find that there is anything that can awaken awareness of what is happening, where it is happening? Does it have to be a ride-along like you have seen, or could there be a social push to really drive home the prevalence and scale of the problem domestically and internationally?
Yeah, absolutely. So that was the next area. The research that I found was, again, so much that's counterintuitive. Education on these things, awareness, actually helps to reduce it. Just education. More people speaking out. The thing that keeps it alive is the silence, the secrecy, people thinking it's just them. I've been blown away at how many clients I've had and people I've met that think it's just them or just two people that, maybe one other person they know. No, it's a cultural, societal issue. It doesn't have boundaries with countries. It's not just the secret thing. So I'd say bringing it out to the open, education, not victim blaming, putting the focus on the perpetrators. And the perpetrators, by the way, the research has been done, which is quite limited, but it shows a lot of them also have mental illness. Some of them have severe depression, very low self-esteem, they're isolated. They also have issues, and it's not excusing what they do, but it absolutely is part of the issue. And there's been some cool initiatives, they're limited again, but to help perpetrators to get mental health services, to get more connected, to build better social skills, to help them so they're not so sick. And so seeing it more as like a sickness, I think is helpful. In terms of people that think they're safe from it, that it's not going to happen to them, they're insulated. I really wish I could say there's cut and dry rules. I have not seen any. And I can honestly say no one I've worked with on this topic has seen any. I guess the only rules really are someone that has access and you're in a vulnerable situation and they think there's no consequences, they're more likely to do it. People with disabilities are more at risk. Children are more at risk. Foster care children, because they're more vulnerable. I've also seen, and it's terrible, but in theory, let's say you have a family system and one person is a breadwinner. That breadwinner knows that the other family members are vulnerable. They are more likely to be a perpetrator to someone in the system. So when you have power dynamic imbalances, so in terms of like protecting yourself, I know that different religions have tried, different things have tried. We know now with the research, and this is again counterintuitive and you could say sad, we used to think it's some stranger in the parking lot that's going to attack you that you need to be afraid of. And yes, that can happen. Don't walk by yourself in dangerous parking lots at night, but it's more likely to be an intimate partner. It's more likely to be a family member or even a parent or somebody that's close to you, like a neighbor. Someone that is closer to you is actually more likely to hurt you, at least in the West. In other places, maybe not so much, like in the situations like in Tanzania that I saw, the people that were assaulted, it was a lot of times strangers that would just break into their homes. But it's harder to break into someone's home in the West. So it's, in terms of protecting yourself, I'd say people empowering themselves as much as possible. I found to be the greatest protection, loving yourself, taking care of yourself, making sure that you're not around people that are treating you badly. Because sexual abuse is also especially more in the West, tied to the cycle of abuse with verbal, physical, financial. So if someone's doing certain types of abuse, they're more likely to do other types as well. Not allowing yourself to be treated badly. And that's easier said than done. And it goes back to education as well, educating people on what abuse is, what love is. And I don't just mean relationship like partner love, I also mean family love, friend love, and educating people more on self-love and taking care of themselves and looking out for themselves. Not in a fearful way, but in a way where you are not going to allow yourself to be disempowered as much as you can. It's about power and control.
Mm-hmm. Well, to come back to some of what you mentioned about working in Tanzania and other kind of instances of humanitarian crisis, mindfulness and mental well-being during crisis, where it's not just the personal crisis that is happening in a community, but landslide or flood, or as we've seen in the recent couple of years, pandemic and drawn-out economic instability. How does the duration of exposure affect mental resilience, the ability to cope with another day in a hard environment with people around you where, you know, if everyone's going through that same circumstance, then things will become especially fraught on a community level?
In terms of natural disasters, when you have more collective issues, it makes it a lot tougher. So something called complex PTSD, which is a newer diagnosis. A lot of people have confusion if it's similar to borderline personality disorder. I think the best way to understand it is, from what I've seen, because I've worked with people that have CPTSD, is it's when you've had chronic traumas and multiple traumas, and it's beyond your capacity to handle. So what happens when you have more and more and more things happen? I mean, I guess the best way of saying it is it becomes even harder to get out of it. It becomes even more difficult to be resilient. And people need support with building resilience. For example, in Southeast Asia, when there's been some research with different events that have occurred, when you have a more collectivistic society and you have people that have had trauma, you can become traumatized yourself from what happened, and then you're traumatized by the other people's trauma because you're all trying to work together and you're all more interlinked. And that doesn't help societies to move forward. It actually makes it really challenging. And on that note, I'm actually involved right now in a project in Mali. I've also done some work in Mali before there was the violence. They were microfinance initiatives, but I remember I did focus groups, this organization, Freedom from Hunger. In the focus groups, again, the focus groups were about these projects to help women make more money, have more food, have better health. But a lot of them, they wanted to talk about their depression, their hopelessness, their feeling of no energy, their feeling of there's no hope. And so something that was designed was these support groups where these women could come together. And I'm not saying it has to be women, it could be men, it could be whoever, whatever you want to do as a support group. But these groups that would come together and they could talk about their experiences. They could learn new skills like psychoeducation with resiliency. In the new initiative, they're also learning about things like abuse, things like taking care of yourself. They're learning about symptoms of trauma because that's something we take for granted. Sometimes people just think, well, this terrible thing happened, we have to keep surviving. So I'd say the support groups combined with some education can be helpful for collectivistic society or individual society.
And did you ever find during any of the time that you spent abroad or domestically, there was the attitude of these people have been in natural disaster, like floods in Southeast Asia. What are we doing sending psychologists along when they need tents, they need food, they need external stability before we can address the internal?
I remember bringing this up to people. I was like, look, this is what they're telling me. They're having depression, there's no motivation, hopelessness. Like, what about also adding in some mental health stuff? And it was always, well, the funders aren't interested in that. This is what the funders want. And I would bring it up again. I see this stuff with sexual violence. This is what they're telling me is their problems. Why aren't we dealing with this with the funding? Like, well, the funders don't want that. This is what the funders think is the way we should go. Part of it is I'd say education for whoever's doing the funding, which gets tricky when some of the funding is coming from government and government is funding initiatives that have certain political agendas. That becomes challenging. But either way, you can always try to educate funders. More recently, there's been more of a movement, and I've written on this as well, that is exciting. It's mental health first aid and mental health literacy, which essentially means that we're not sending exactly psychologists. That's too compartmentalized sometimes for these crisis situations. But the community workers that are going to go in, the crisis workers, they can be trained with mental health first aid, with some of these basic things with psychoeducation. So if they lead any groups or do any health education or different types of initiatives, they can mix in these very important things into the work that they're doing. It doesn't have to be so black and white, and it's not black and white. And if you want these health recovery development initiatives to be successful, you got to address the mental health piece. Because if you have people that are traumatized, trying to overcome violence, they don't feel safe, they're dealing with abuse at home, they have depression, and then you give them some money and tell them about washing your hands, you're not really honoring their humanity. You're treating them more like it's simple. It's more black and white than it is. It's not any different from you or I. We have to address the whole piece. So yeah, tell them about washing your hands, whatever, give loans to help or money to help, but also talk about trauma, also talk about depression, also talk about some tools that they can use. And mental health first aid provides some basic tools and support. And I think, too, the power of the support groups is huge. They were not meant to be support groups, but when I did the focus groups in Mali, and I did them in Ghana, too, and then when I did the interviews in India, but then also in Tanzania, it wasn't meant to be a method of support, but people were so desperate for someone to hear their story, for support, that it sort of became that way. This is what they wanted to talk about. So honoring what people share they want, not what you think they should have, which is more of a grassroots versus a top-down approach.
Like, I've got no background in this. I've just heard what you've told me, but it makes so much sense that if you're going to be providing help to people, then finding out what they want is going to be an important part of that.
Absolutely. Otherwise, it's kind of insulting. You're coming in thinking you know better, and even when people give you feedback on what they need, and you're saying, no, this is what you need, it's a waste of money as well. And unfortunately, I hate to say this, but this is something that I've seen, and that's why personally I'm very interested in more grassroots movements that people are saying this is what we need, and they're implementing it. It's more dollar efficient, and it's more impactful in terms of positive outcomes from what I've seen.
To ground some of this work, not just in the geography that we've covered, but also in the history, we have collectively been through some very strange, traumatic, for some people a lot more severe times. Is that something that, as a case study, with a lot of death tolls being tracked across hospitals, across countries, with a lot of well-being initiatives being tracked and being set up across counties and across health systems, is something that is going to really inform future development for crisis response and psychological well-being, or is it all kind of things that you've seen already that are now being put into action?
My understanding is there's been a huge emphasis on the cases with COVID and the deaths from COVID, which is tragic. I myself had COVID, actually more than once. It was terrible disease. But looking at the science, the numbers, instead of just what is on being kind of more pushed, from my understanding, and I would need to double check the numbers, but my understanding is there was a huge issue with suicide, depression, addiction, overdose, intimate partner violence that really was not addressed. Because my understanding is, and again, I'd have to check this number, but I believe more people died from intimate partner violence in Mexico than COVID during COVID. And that's not something that's talked about. The US has a huge drug epidemic that has been going on, but is much worse now than ever before. And it's completely tied. And so the mental health piece is not divorced from the health piece. Obesity in the US, I think the average person gained like 30 or 40 pounds during the epidemic. That is a lot of weight. And on top of it, we already had a society that was considered obese, generally speaking. It was already a problem. So when you have these endemic issues, the racism issue, if we only look at the black and white numbers of, life versus death, sick versus not sick, we're not looking at the whole piece of it. So in terms of crisis response, I think it needs to be more intricate. It needs to be more holistic, and it needs to be bigger. And maybe we don't have the system set up yet for that, but looking at the actual data of what's going on, not just the data of what's highlighted, is essential for coming up with solutions that are going to have a positive impact. But the US is still reeling, and I hope recovering, although maybe not, maybe it's just getting worse, from the mental health impacts of COVID. And I think that's true for a lot of the world. I know that the rates of mental health or mental illness with children are much higher now than they were before COVID. And what's being done about that? And how are these children going to inform our future? And this is not just US, this is in general, I'm sure in Europe as well. Because you have these children that were isolated, they had to be at home, they were hearing about all these terrible things all the time, and it affected their development in important years.
You mentioned it earlier with the education initiatives and awareness, but that overall prevention is better than cure. This is something that you probably will see around, that probably is happening maybe a few doors away from you, that this is here now, and to recognize it is hard, to take action is hard, that it is on all of us to stop that friend who is misbehaving in the pub, to call out catcalling when we see it. Do you see that there is a place for mass media, for a public health initiative to break the cycle of permissive aggression and dehumanization, and that can hopefully have maybe long-term lasting effects for the well-being of everyone in a society?
Absolutely. Awareness, education is huge. Sort of an unfortunate thing. People might think, people will naturally do the right thing, only certain outliers are doing problematic things. But a lot of people need education. And I don't mean the reading and writing kind. I mean education on things like, don't stalk someone. This is what stalking is. If you've done these behaviors, this is stalking. Helping people to understand, they need to be educated on, okay, when you do this, it hurts someone else. And that might be kind of tragic, but one of the first things I usually do with a lot of my clients in my private therapy practice, I have them take an empathy test. Usually after their first session, there's an empathy test that I like. It's just sort of a good baseline. Most people have quite low levels of empathy, actually, at least with the clients I've had, and mostly in the US, but I don't know, it might be similar in Europe. Maybe it's better, I don't know. But empathy is very tied to violence, because when you have low levels of empathy, you don't really think about your impacts on others. You're thinking about yourself. You don't understand you're hurting someone else. When you have higher empathy, you don't want to hurt someone because you're hurting yourself when you do it. I know there's been more research done at UC San Diego, and I think they got a big grant recently regarding empathy training. And it used to be thought, well, you can't teach that, but I think it is teachable. And the first step is people understanding where they're at and how low their empathy actually is. So yes, absolutely. I think there is a space here for education with mass media. And there are people that I think they truly don't think there's anything wrong with what they're doing, and they need to be taught this is not okay.
And this all leads to your work on a happiness framework, a happiness index. Could you tell me more about that?
It was last year. I was reflecting on all this a lot, and I'm thinking, well, how does this all tie into happiness? And maybe happiness seems like too cheerful a word, but what's the opposite of depression? You could say it's happiness, not getting to neutrality. What I identified was I looked at different happiness frameworks, different theories basically on well-being, and I didn't see anything that looked at all the complexities and intricacies as much as it could. And maybe there's something out there I'm not aware of, but it's not highlighted and no one's told me about it yet. So it shouldn't be so hard to find. A lot of the research, and even with the major institutions that study this stuff, it's things like the hedonistic treadmill, which is about pleasure versus pain. It's about, do you get what you want versus not what you want? It's not exactly taking into account all the factors, we have, or it just focuses on biology. Unfortunately, happiness and well-being is more complex. It's not as simple as I have what I want, therefore I'm happy. It's not as simple as my physical health is good, therefore I'm happy. There's many components to it. And there's a fantastic study through Harvard University. I think it's the longest running study on human well-being and development. And it looked at well-being from Harvard students over a lifespan. And then now it's looking at their children, so the next generation. And across the board, what they found, regardless of economic status, regardless of education, your ability to have authentic connection, good close relationships, not number of relationships, it could be of one or two, but close relationships and connection is one of the most important components for health and happiness. But it's not the only one, but it's probably one of the most important. So what I did with the framework is I looked at different variables that have been identified as significant. So our biology, that we have our basic needs met, and that we feel safe. Safety is huge. And feeling safe. When someone's had trauma, they don't feel safe. So addressing that. Looking at the connection piece. How is their relationships, their authentic connection? And so looking at the different elements as a whole is important instead of just thinking it's one or the other. I don't know if it's sort of a poverty mindset if we think, well, we're lucky if we could just get the basic needs met. That's all we can do. I think that what if we expand our awareness and our consciousness to think, what if we could get multiple things met at once? What if we can integrate it all together instead of just thinking, well, we can only do this. We can only provide food and water, or we can only provide shelter. So those things, like for initiatives, it is a poverty mindset. Why can't we think a little more holistically and have it actually be more impactful? Part of the reason why I got into the interest of happiness and also mindfulness was because I actually originally was looking at malnutrition, severe poverty when I did my first PhD. And then I was like, this is depressing. I started looking at depression and I'm like, okay, what are solutions for depression? And I'm like, this is depressing. If I read 100 articles on depression, I'm going to feel worse. And there has to be something more. What if we try to start from happiness, start from mindfulness, start from a different framework and build from there? And I find sometimes, and I think Albert Einstein said this, you can't come up with a solution from the same place as the problem. Sometimes you have to, oddly enough, start where you want to be, in the sense that, okay, we want to build more happiness. We want to build more mindfulness. We want to have more health. What are the components of health? How can we build from that framework of health and happiness and well-being instead of building from the framework of depression and poverty and scarcity? All the problems that are happening, it can be overwhelming and disheartening, and people can feel like it's hopeless. But another way of looking at this could be these problems have been around for a long time. Maybe they're exasperated now, but I think they're coming to surface so we can see them more clearly and see how things are more complex than we thought before. So I think this is an opportunity to be like, okay, how can we create a collaborative, integrated, holistic solution or approach instead of being so segmented with certain variables, instead of seeing that maybe there's a lot of interconnection.
If people need further information or support about any of the topics that we've covered, is there anywhere that they could head to following this episode?
Yeah. Well, in Florida, you can call the number 211 and it will route you to crisis services. If you are suffering from abuse or different traumas, I encourage you to look up online local domestic violence shelters, or there's community mental health centers, rape crisis centers, but also NAMI is a great resource. NAM. If you look up NAMI online, they can point you to a lot of great resources, and they are a national network for mental health. And from there, I'm sure that someone could be supported no matter where they are in the country. I have a Instagram called Happiness Learned. I have my website, which is drsaraspowart.com. And I'm starting a new website that is happinesslearned.com. If you check out Happiness Learned, it has to do with all of these things and how we can kind of get ourselves from a low point to a better point.
Dr. Spowart, thank you so much for your time today, and I look forward to speaking with you again sometime soon.
Thank you so much. It was a pleasure.